In 2008, the University of Melbourne introduced the new Master of Teaching. It's a graduate entry program, so it builds on the analytic thinking that comes with having a university degree. But it also embraces the disciplinary knowledge learned in that degree. But the Master of Teaching is a paradigm shift. So why did we need a paradigm shift? Well, simply, traditional approaches to teacher education are not working. In the so-called traditional approaches, there's limited connection between the university lectures and the school experience. The school experience is in short blocks, separated by long periods away from the school. Students are parachuted into a school and often told, forget all that stuff, I'll teach you everything you want to know about teaching. But the profession of teaching is too complex and challenging for this type of approach. In 2008, only 41% of new teachers in Australia felt they were well prepared or very well prepared for their teaching. So what have we done? Well, first, we've recognised that teaching is indeed a clinical practice profession. But what does that mean? Well, like other clinical professions, doctors, psychologists, audiologists, it is focused on the individual. It's focused on the individual learner. The learner is at the heart of everything we do. And it's about meeting the learning needs of that learner. But to do that, we need to gather evidence. So the Master of Teaching is about gathering evidence to ascertain what a learner knows now and what they're ready to learn next. And then, of course, it's about creating the appropriate learning strategies to take that learner to that learner's next level of knowledge. And like other clinical professions, the profession of teaching is underpinned by a well-defined body of knowledge. And this includes deep knowledge of child and adolescent development, of learning, of social contexts, of subject matter, and of the subject matter pedagogy. And as well, there's a well-defined practice. But unlike other clinical professions, it's not focused on fixing a problem. The Master of Teaching is developmentally based and is focused on enhancing learning and enhancing development of each individual. So if it's a clinical practice profession, it means that we have to use clinical teaching models. And we do this so that we can integrate theory and practice throughout the program. Candidates spend 2 days a week in schools and 3 days in the university from very early in the course. And the candidates are supported by experts, university-based clinical specialists and school-based teaching fellows who help them make the link between the theory they learn in the university and the experience they have in the classroom. So we're able to teach theory in the context of practice and sequence the practice with the theory throughout the course. And candidates are taught how to assess where students are now in their learning and construct tailored learning interventions to meet the needs to take them to the next stage of learning. And the school-university partnerships are vital to the program's success, just like the hospital-university partnerships for medical students. And in that case, in our case, there's a shared thinking in the school and at the university. This is a genuine two-way partnership. So have we been successful? Well, of our graduates who entered teaching at the start of 2010, 90% said they were very well or well prepared for their teaching, a much higher total than the average in 2008 of 41%. So is all this important? Well, research shows that for all of the controllable factors that influence student achievement, the most important by far is the effectiveness of the classroom teacher. And the Master of Teaching is about developing effective teachers.